Now, through my presentation, I would like to support the lecture with some articles and my clinical cases regarding implant therapy. Our Japanese book called 4D Concept Implant Therapy was published in 2008. This book was translated into English, German, Chinese, and Korean. So last year, we renewed this book. Also, this is only written in Japan. Look at the following topics. Firstly, I would like to show you why there is a need for the 4D concept in aesthetic implant therapy. Secondly, I would like to talk about the correlation between extraction and implant placement. Including classification of immediate implant placement, partial extraction therapy, and original GBR techniques. Thirdly, I would like to mention about shadow in implant treatment from the viewpoint of long-term prognosis. Finally, I would like to talk about the possibility of supracrestal regeneration and reconstruction papilla for saving teeth. The key to successful implant therapy in the anterior aesthetic region is in the harmonious final relationship between the implant-supported restoration and surrounding natural teeth. As we know, it is important that the implant should be placed at three-dimensional position based on three-dimensional consideration of aesthetic result. In Mesio-Distal, we should consider the distance from tooth, pontic, or implant. In depth, the implant should be placed 3 mm below the superstructure. In direction, it is better that the implant axis is not being on the edge of superstructure for screw retaining. In buccal side, the implant should be placed 2 mm into the superstructure. Furthermore, we should consider further to preserve the original level of buccal tissue volume. However, are these existing factors enough to get best possible outcome? Achieving optimal aesthetic result needs to go beyond utilizing the appropriate clinical techniques and instruments. We must consider fourth dimension, timing of the treatment sequence. This additional fourth factor in treatment planning refers to the optimal timing of when to carry out each of procedures. Here are the clinical procedures we can list up: tooth extraction, preservation or enhancement of hard and soft tissue, implant placement, abutment connection, tissue modeling with a provisional and/or modified abutment, final restoration. For every single procedure, we need to consider optimal timing. This additional axis of time is added to the traditional 3D axis and described as the 4D concept in implant therapy. It is important that there is a correlation